Picture this. Your dog sniffs out some random mushroom on your walk, and bang, before you can even move, it's gone.
Happens all the time.
Yeah, seems harmless, maybe. But here's something, well, pretty sobering. Certain mushroom poisonings, they send a really shocking number of pets into critical care. And sadly, some just don't pull through.
It's a serious issue.
Okay, let's unpack this because, what seems like a tiny risk can actually be a huge threat. Today on the Deep Dive, we're getting into veterinary mushroom poisoning. We're digging into the medical literature to give you the essential info, nice and quick.
Yeah, and what's fascinating and honestly kind of alarming is that it's not just one type of bad mushroom. Our sources point to 8 distinct categories of poisoning in animals.
8, wow.
Yeah, each one triggered by different toxins, causing totally unique health problems. It sounds like a lot, I know, but getting your head around these categories is really the first step in spotting potential danger.
Exactly. And we know you're busy, right?
Yeah.
You want the crucial stuff without getting lost in, super technical jargon. So our mission today is clear. We're diving into these 8 types. We want to understand what makes each one dangerous, how they actually attack the body, the key signs you need to watch for, and, well, what the outcomes could be.
Think of it as your shortcut to being properly informed on this hidden hazard. We'll use those 8 categories, based on the toxins and the symptoms as our map today.
Perfect. Where do we start?
Let's start with the most infamous group, and sadly a really common and severe one, the cyclopeptide group.
Okay.
This includes some truly nasty mushrooms like the famous Amanita phalloids. People often call it the death cap.
Death cap. Yeah, that name definitely grabs your attention. And for good reason, I take it. The research shows this group means serious trouble, high rates of, severe illness, and even death for pets.
Absolutely.
So what makes these ones so incredibly toxic? How do they work?
It's pretty insidious, actually. Cyclopeptides have these toxins called amatoxins and phallotoxins. The amatoxins are the main problem here. They basically block an enzyme called RNA polymerase II.
Okay, RNA polymerase II.
Right. And simply put, that enzyme is vital for cells to make proteins. So amatoxins just wreak havoc on cells that divide really quickly. Think intestinal lining, liver cells, kidney cells.
Ah, okay.
And the phallotoxins also target the liver, but they mess with the cell's internal structure, the actin. So it's like a double whammy on vital organs.
Wow. Okay, so it's like shutting down the factory in some of the body's most important systems.
Yeah.
And the illness, it unfolds in stages, right? 3 distinct phases.
That's right. It's quite characteristic.
Can you walk us through those? What do they look like?
Sure. The first phase is gastrointestinal, the tummy troubles. But here's the sneaky part. It doesn't happen right away. It usually takes more than 6 hours after they eat the mushroom for symptoms to even start. And when they do, they're bad. Severe vomiting, sometimes bloody, really awful abdominal pain, fever, dehydration.
Oh, man.
And then you get electrolyte imbalances, even dangerously low blood sugar. It's rough.
Sounds absolutely horrific. But then there's this period where things seem to get better, this latent phase. That sounds almost more dangerous because an owner might think, phew, crisis averted.
Exactly. That's the really deceptive part. This apparent recovery, which might last, say, 12 to 24 hours, is what makes these poisonings so incredibly treacherous.
You think you're in the clear.
You might think your pet's bouncing back, but nope. This is where things get really interesting and deeply concerning.
Because then the hepatrenal phase hits. Liver and kidney.
Precisely. This phase usually kicks in about 3 to 4 days after the mushroom was eaten. And now we're talking full-blown liver and kidney failure.
Oh, no.
You might see jaundice, that yellowing of the skin and eyes, plus neurological signs like severe lethargy, confusion, maybe even seizures. Blood sugar can crash, you can get serious bleeding problems, body chemistry goes haywire, kidney function tanks, heart issues. It can lead to coma and, tragically, often death.
So that delayed start, the gut problem showing up late, followed by this awful comeback with liver and kidney failure. That's the big red flag for this type.
That's the classic devastating pattern, yeah.
And what can vets actually do? The source mentioned no treatments are proven effective, which is chilling.
It is a really sobering reality. Treatment becomes mostly supportive care, trying to prop up the body's functions. Things like thioptic acid, silibinin, sometimes paired with acetylcysteine, even penicillin are mentioned.
But their effectiveness?
Still debated, honestly, in the vet world. The real focus is intensive care. giving glucose for blood sugar, maybe plasma or blood transfusions, vitamin K for clotting, diuretics, dopamine to support the kidneys.
It sounds like a massive effort.
It is. It's all hands on deck, hoping to keep the animal stable long enough for the body to maybe recover, but the odds can be tough.
Okay, let's shift gears. The next category, monomethylhydrazine, or MMH, includes some Amanita species, Gyromitra mushrooms. The literature says it's less common than the cyclopeptides, but still a worry. What's the main issue here?
Right. The danger here is from a compound called gyrometrin. When an animal eats these, gyrometrin breaks down into MMH in the body.
Okay.
And what's interesting here is that MMH messes with a key neurotransmitter in the brain called GABA.
GABA, the calming one.
Exactly. Think of it as the brain's natural brake pedal. MMH reduces GABA activity, and that triggers neurological signs.
So if a pet eats one of these, what might an owner see?
Well, you often get that initial gut upset, again, vomiting, diarrhea, and again, typically delayed, showing up more than 6 hours later.
Like the cyclopeptides?
Similar delay, yeah. But the key signs for MMH are neurological. Ataxia, that wobbly, uncoordinated movement anxiety, hyperactivity, tremors, sometimes even seizures.
Okay, so delayed GI, but then more obvious brain-related symptoms. How serious is this one usually? And treatment?
The good news, relatively speaking, is that MMH poisoning is often self-limiting. Most animals recover with supportive care over a few days.
That's better.
However, in rare, severe cases, you can see liver failure. But here's another bit of good news. There's a specific antidote, pyriboxine, which is just vitamin B6.
An antidote. Okay.
Yeah, so while it's still serious, it's often more manageable if caught and treated properly.
That's definitely reassuring compared to the last group. Now, what about the muscarine group? Clitocybe species. Our sources say this one hits fast.
Oh yeah, very fast. Muscarine poisoning usually shows up really quickly, typically within just 15 to 60 minutes after eating the mushroom.
Wow, okay.
And thankfully, it also tends to clear up relatively quickly too, usually within about 2 to 24 hours.
And the way muscarine works is different again, right?
Totally different. Muscarine acts as a post-ganglionic cholinergic agonist.
Meaning?
Basically, it overstimulates the parasympathetic nervous system,
Right.
the rest and digest part. It's like cranking the volume way, way up on functions like salivation, digestion, urination.
Ah, okay. And there's a mnemonic for the symptoms, right? Dumbbells. Can you break that down so we can remember it?
Sure, it's a classic. D is for diarrhea, U for urination, M for meiosis, that's constricted, tiny pupils.
Meiosis, okay.
B is for bronchospasm, or bronchorrhea, tight airways, or lots of mucus in the lungs. E for emesis, which is vomiting. L for lacrimation, excess tearing. And S for salivation, tons of drool.
Dumbbells. Got it. Lots of fluids.
Pretty much sums it up. Increased secretions, gut distress. But the good news here is atropine. It's a very effective antidote that blocks muscarine's effects.
Okay, dumbbells, memorable, but definitely unpleasant. Let's move to the ibotenic acid muscimol group, found in mushrooms like Amanita muscaria, that classic red and white one.
The fairy tale toadstool, yeah.
This group also hits fast, apparently, and causes some pretty weird CNS effects.
It does. Signs usually start within 30 to 60 minutes, and the mechanism is quite cool, actually. The ibotenic acid initially acts as a glutamate agonist. It stimulates nerve cells.
Okay, stimulation first.
But then it quickly gets converted in the body to muscimol. And muscimol does the opposite. It's a GABA B agonist, so it depresses the central nervous system.
So it's like hitting the gas and then slamming on the brakes in the brain.
Kind of like a biochemical seesaw, yeah.
So what does that look like behaviorally? What might an owner see?
Exactly that alternating pattern. It might start with stimulation signs. Ataxia, again, hyperactivity, running around aimlessly, maybe excitement, even seizures. There's a really weird characteristic sign sometimes described as biting at imaginary flies.
Huh, weird.
Yeah, but then this can flip to CNS depression, drowsiness, stupor, even coma, and these cycles might repeat.
Cycles, okay.
Importantly, though, unlike some others we've discussed, gut upset is typically not a feature here, and thankfully, death is rare.
Okay, that's good to hear that death is less likely. And for treatment, the source says diazepam for seizures, but warns against atropine and propofol. That seems really important for vets.
Absolutely critical. Because the underlying cause is different for each group, the treatments vary. And like you said, what helps one type could actually hurt another.
Makes sense. Okay, next up, hallucinogenic mushrooms. Psilocybe species, for example, Onset within about 4 hours, and the source mentions sympathomimetic signs.
Yes, the active stuff in these, like psilocybin, gets converted to psilocin in the body, and psilocin acts as a serotonin agonist.
Serotonin, like the mood chemical.
Exactly. It binds to and stimulates serotonin receptors in the brain, and messing with those serotonin pathways causes a range of neurological and behavioral effects.
So what signs are we likely to see if a pet gets into these?
You might see dysphoria, like general unease or unhappiness, anxiety, confusion, agitation, sometimes even aggression. They can get hyperthermic, meaning their body temperature goes up.
Okay.
And in rare cases, you could see convulsions, coma, or even death. But interestingly, like the Amanita muscaria group, GI upset usually isn't a big part of the picture.
Got it. And our source brought up some interesting points about these, like dried ones stay toxic for ages. They could be put in extracts, even hidden in chocolate.
Yeah, that's a real concern.
And apparently used as holiday gifts or sold openly sometimes, which just highlights how accessible they might be, right? Especially mixed with chocolate. That sounds like double trouble.
It absolutely is. The chocolate combo is worrying because then you add the risk of theobromine toxicity from the chocolate itself,
Right.
which has its own set of serious problems. And yeah, increased accessibility definitely raises the risk of pets accidentally eating them. Diazepam is again mentioned for controlling seizures if they happen.
Okay. Moving along, we have the GI irritants group. Chlorophyllum species, for instance. Sounds maybe a bit less severe. Rapid onset, quick resolution.
That's generally right. Signs of gut irritation usually pop up within about 2 hours of eating them.
Pretty fast.
Yeah, and they're usually self-limiting, meaning they sort themselves out within about 24 hours. You'll likely see things like malaise, weakness, vomiting, diarrhea, maybe some fluid or electrolyte issues from all that.
Okay.
Unpleasant for the pet, for sure, but typically not life-threatening like some of the others.
Right. Definitely want to avoid it, but maybe not panic stations like the first group. Now, the acute renal failure group. Orellanine toxins, Cordinarius species. This sounds much more serious, especially with that really delayed onset.
Yes, this group is particularly nasty because the signs of kidney damage can take ages to show up, sometimes as long as 20 days after ingestion.
20 days. Wow.
Yeah, it's incredible. The suspected mechanism involves toxins that are sort of similar to herbicides like paraquat and diquat. They're thought to damage the kidneys through something called redox cycling.
20 days.
Yeah.
An owner would have no clue their pet was in danger for weeks. What kidney signs would eventually appear?
Well, initially you might see the kidneys struggling, so maybe increased urination, polyuria.
Okay.
But that's often followed by a stage where the kidneys can't concentrate urine properly. That's isocinuria. And it can even progress to the kidneys shutting down completely, stopping urine production. That's amuria.
Oh, that's bad.
Very bad. You'll also likely see electrolyte problems, especially high potassium, and signs of uremia, the buildup of waste products in the blood because the kidneys aren't filtering.
And the prognosis?
Unfortunately, generally very poor for orellanine poisoning. The literature mentions trying things like furosemide or dopamine if urine output drops to try and support the kidneys. But once significant damage is done, recovery is often unlikely.
That really drives home how important it is to remember any potential mushroom ingestion, even if the pet seems fine initially.
Absolutely critical.
Okay, before we wrap up the categories, the source mentions some general risk factors too, things that make poisoning more likely.
Yeah, a few things. Lack of experience in identifying mushrooms is a big one. Owners might accidentally bring toxic ones home.
Right.
Sadly, owner substance abuse can be a factor, potentially increasing access to psychoactive types. Cultivating or trafficking hallucinogenic species in the home, obviously a risk. And just the time of year, mushroom season in the fall naturally means more exposure potential.
Makes sense. And for diagnosis, it sounds like identifying the actual mushroom is key. Plus, lab tests, like the Meixner test for psychopeptides, or finding toxins in body fluids, or the mushroom itself.
Absolutely. Knowing exactly which mushroom it was can really help vets figure out the best course of action, treatment-wise.
And there was that quote, too, as a warning for foragers. There are old mushroom hunters, there are bold mushroom hunters, but there are no old and bold mushroom hunters.
Wait, that really says it all, doesn't it?
It really emphasizes the risk of getting it wrong.
It's a powerful reminder. Even if you think you know mushrooms, mistakes happen, and the consequences can be severe, even fatal. Always, always better to be safe than sorry.
So wrapping this up for you, our listener, This deep dive really shows the incredible variety in how these mushroom toxins work, doesn't it?
It really does.
We've gone from poisons that hit fast and hard to ones that sneak up over days or weeks, causing irreversible damage. The absolute crucial takeaway here is, if you even suspect your pet ate a wild mushroom, get to a vet immediately.
Don't wait. Don't wait for symptoms, especially with those tricky, delayed onset ones.
Exactly.
And as we said, this was a focused look based on the current vet literature. There's always more to learn, of course, but hopefully this gives you a much clearer picture of the dangers lurking out there in the fungal world and why being vigilant is so important.
And it really makes you think, doesn't it? Looking at these mushroom toxins in detail just highlights how many potential hidden dangers might be around for our pets. A plant in the garden is a fungus on a log. Maybe this deep dive encourages you to, take a closer look at your surroundings, be a bit more mindful on that next walk.